So today we're going to talk about the numbers you need to know and the things you really should be tracking in order to tell what is going well and what maybe needs a little bit of work. I consider all of these things KPIs. And when I say KPIs, some people turn off their brains. But I think KPIs are exciting because I love having facts. I like having something to look at that tells me a story because it makes decision making so much easier. I am an orthodontist, and I always say to people, I generally don't like to guess. I like to be able to measure things. I like to know exactly what I'm shooting for. It's the same way for my practice. So a quick note from me before we dive into all these beautiful KPIs. I don't think there's any one right way to run a practice or to grow a practice. Meaning, the numbers that I'm going to talk about that are important to me and the ones that I think you should be looking at, you can decide if those numbers are important for you or not. The numbers have to make sense for you and for the goals that you have for your practice and where you want to take it. This is a solid general foundation, but you may have some specifics you need to get into depending on what you're doing in your practice. And there may be some of these that you're like, meh, not important to me, and you can just let them go. For some people, changing things means deciding if you have overhead that's too high, deciding if you have too many team members or are paying them too much. Maybe you need higher new patient volume and everything else is awesome. I can't tell you what is right or best, and I don't believe in that. What I believe in is knowing the facts, getting a clear picture of where you are right now, and then making decisions from there. And the biggest thing I want you to take away from this is you can get facts, but then you have to take action. The key is always to take action. You could gather data for months and months and months and years and years and years and know everything that's happening inside out and upside down and backwards. But if you never take action to change the things that will make the practice what you want it to be, then of course you're not really going to make any change. So let's start with the very big stuff. This is the stuff that I really do think everyone should know. Production, collection, and income. So you should be tracking and at any moment be able to look at how much production. So how much dentistry are you producing in a month, in a quarter, in a year? You also need to know how much money you're collecting, because of course it would be great if that was always 100%, but with insurance and all kinds of other things, that isn't always the case. But you should always know what those numbers are, and if you're happy with the disparity between the two of them. And the third one, income, is one that I think some people forget about a little bit. You can have a practice, a dental practice, that maybe has a production in your mind that you think is low, but the income for that doctor is exactly what they want and need. Maybe they're super thrilled making $150,000 a year. They have a spouse that also makes a good income. They live within their means and they are happy as pie, living their best life. There is no such thing as a perfect income. You have to decide how much income you want to be making and then decide what changes have to happen in the practice. So you should always know how much you're producing, how much you're collecting, and how much you are taking home. Okay, at any given moment, you should be able to know these things. You need to know overhead. And when I say overhead, because that is a very big word, I mean in categories. So you have to have a bit of a breakdown here. I don't break down every single line item in my overhead, but I know how much my lab bills are. I know how much my salary costs are. I know how much my supplies are. So have your big categories for overhead so that you know where that spend is going. Because of course, the overhead compared to your collections is going to show you what is left over, right? And I think it's important if you think your overhead is too high, especially if you think it's way too high, get as detailed with it as you possibly can, because you might think that the answer to fixing high overhead would be to let go of a team member or find a new lab or something like that. But you actually need the breakdown of all of the numbers to make a decision about where the easiest or best place might be to cut costs. Now, we'll come back to this in a second. I usually think if overhead is too high, the faster, easier way to fix it is just to increase your collections. So to make more money, to produce more dentistry. But sometimes you have to tackle overhead as well, especially if you think it's really out of control. And let me give an example of why that's true. So let's say you're running a practice of any kind. Let's say orthodontics, because we tend to run a higher overhead than general dentists. If you have an overhead that is 70%, and some of you might be like, oh, I would die if it was 70%, but you're making an income that you're super happy with, then the details of your overhead are probably relatively unimportant to you. Because you might be spending a lot of money, but you're probably making a lot of money. And if you're okay with that, then there's probably no reason to break down to the nitty gritty of where your overhead lies. You keep an eye on it. If it's trending in the wrong direction, you start to look at it. But let's say your overhead is 55%, but you're taking home less than you want. Well, maybe you need to take a second to break down your overhead and figure out where are all the places money is leaving the practice. And then you can decide if there are some places there that you can make change. And like I said, I think it's easier to boost your revenues than to cut costs, but there is opportunity there some of the time. So big numbers out of the way. What are the KPIs you need to know? So which key performance indicators are going to tell you how you're doing through the whole patient process? So we're going to start from the beginning of the new patient experience and then work our way all the way to follow-up. So what do you need to know? I think you need to know your call to booking ratio. That means how many new patient calls do you get each day, week, and month, and how many of those turn into booked appointments in the calendar. Okay, this should be a number you're very happy with, and if it's not, you need to spend time here. You should be tracking how many calls per day go to voicemail. The stats are in on this. Calls that go to voicemail, especially calls from new patients, are very unlikely to leave a message. So new patients, less likely to leave you a message than, of course, an existing patient who's just calling to get an update or ask a question or book a next appointment. And so you want to put as few calls through to voicemail as you possibly can in a day, but you should be tracking this to see if you can do better and if people are just letting the phone go to voicemail. You should also be keeping track of no-shows. How many no-shows do you get in a day, a week, a month? If something is not looking good to you with this number, you probably have to do something with follow-up or confirmation of your phone call. So something is happening on the new patient phone call that is not making it seem important or valuable enough for that person to show up. So look at those processes. How many short notice cancels do you get every day, week, and month? Now, especially if you think this is a problem in your practice, so short notice cancels or no-shows, you need to spend some time here and track these numbers over a period of time and figure out where the issue lies, because it most likely lies in the patient not understanding the value of what you were going to provide to them, the time you've put aside. Maybe you need a consequence of some kind, but you get to decide what's best for you, but that's an important thing to look at. Let's move on to treatment. So let's say your call to booking ratio is great. Very few calls go to voicemail. People are showing up to their appointments. What is your treatment acceptance percentage? So for every time you or your treatment coordinator sits down and presents treatment to a patient, what percent of the time do people say, yep, sign me up? If you were trying to do same-day treatment, happens a lot in orthodontics, it can happen a lot in general dentistry as well. What is your percentage of same-day treatment starts? What percent of your new patients leave with a booked next appointment? What percent of your existing patients leave with a booked next appointment? A lot of what I focus on when I'm talking about growing a practice is about new patients, because of course, these are the people you have to impress. But if you're doing more dentistry and seeing more regularly the existing patients within your practice, you're also going to grow your practice. So it's important to look at the metrics that make sense to you for your existing patients. What is your hygiene rebooking rate if you have dental hygienists? What is your hygiene production per hour? For those of you who have new or existing patients that have treatment recommended, but they do not book that same day, how many of those people are booked within 1 month, within 3 months, or within 6 months? So how are you tracking the follow-up that happens with all of these people to get them booked in if they can't make a commitment the first day they come to see you? How do they know you still care and still want to provide that treatment to them? Another one for you. How many of your existing patients are still your patients 6 months from now, 12 months from now, 24 months from now? This is your retention rate. How many people are you keeping within the practice? Of course, the more people you keep within the practice who come and visit you regularly, the fewer new people you need to bring in to keep your income at the level it is at. Let's get into specific procedures or treatments. Do you know what your top 3 most profitable procedures are. They might not be the thing that is the most expensive, but the thing that is the most profitable. And once you know what those three things are, how often are those procedures presented and accepted or booked? Another thing you should be keeping track of, how many reviews go up for your practice each week and month. People care that reviews are happening regularly. They want reviews that are up to date. So you want to be making sure that reviews are going up ideally every single week in your practice. I also want you to look at what is the distribution of new patients across all channels, meaning how did all of the people who found you come to know about you and reach out to you to book an appointment? Was it through friends and family? Was it from another dental provider? Was it through Google? Was it through a Facebook ad? Was it through TikTok? Make sure that you're keeping track of all of the avenues where people are coming in, because if you know where they're coming from and there's a channel that is underperforming, or maybe you're spending a ton of time on a channel, maybe a social media channel, and no patients are coming in through that channel, and it's taking up a lot of your time, maybe you don't need to be spending time on that channel if all of your other channels are doing really well. If you are paying for leads or new patients, so if you're paying a marketing company of any kind or doing it in-house yourself, what is your cost per lead across platforms? Okay, so how much are you spending per person? And is that an amount you're comfortable with to do over and over and over again? One way to help figure that out might be, what is the average lifetime value of these leads that you're getting, that you're paying for? Because if you know that a new patient is worth $600 to your practice on average lifetime, and it's costing you $100 to get that patient in the door, you get to decide if you like that ratio, right? And that might be based on what your overhead is, et cetera, but only you can do the math on that. You probably should also know, what is the average lifetime value of any patient within your practice? So on average, how much money do you get from any person who comes and sees you and stays within the practice for a period of time? This helps you to decide, when you're trying to grow, where to allocate funds. Because if you know how much each person is worth, then you can figure out how much you'd be willing to spend to get that person into the practice. That's a whole lot of numbers to track for now. And like I said, that's just a baseline foundation for how you could figure out what is happening within the practice right now, right? Who's calling? Are they booking? When they come, are they accepting treatment? If they don't, how do you follow up to find out? If you're paying for leads, how much are you paying for it? How much are these people worth? Are all of your channels serving you well? All of these things become critical when we're thinking about growth, because we have to decide, how do we want to grow? Do we want more people to find us on Google? Do we want people to be typing in dentist in your local area, or emergency dentist, or root canal, or braces, or whatever that is? Then you can look at how things are performing on that avenue right now and decide if you want to put more effort into it. Maybe things are falling apart at the phones. And just by cleaning up the phone situation, getting the phones answered more often, getting those phone calls turned into booked appointments more often, you actually fill up your calendar and you really don't need to do anything else when it comes to marketing. I've had that happen with practices. It's crazy. Meaning you don't have to spend any more money. You've just got to train the people who are working for you right now to do a better job. It's pretty awesome. And only by looking at these numbers and knowing these numbers can you actually figure out where you should be putting your time and attention. So you gather all this data, and then you make a few decisions. Do you want to grow your practice by bringing in more revenue? Do you want to cut costs? Do you want to do both? If you want to bring in more revenue, figure out where your patient's coming from. How much are you paying for them right now? How are you handling them on the phone? Right? If you think you need more revenue and you just decide to start throwing a ton of money at marketing, that's sometimes a leap that you shouldn't be taking, because it can make things worse. Why? Because if things like how the phone calls are handled and how follow-up is handled and how treatment is presented is not being handled well, then you're spending a whole bunch of money for a bunch of people to be funneled to your practice, and then it's falling apart off the front end. It's a waste of money. Maybe your receptionist currently only has a call to booking ratio of 50%. So half of the new patient calls that come in don't actually get booked. Just by upping that to 70 to 80%, your practice is going to grow. You didn't spend any money. That's super powerful. So having data puts the power in your hands. I find it to be very empowering to be able to see so I can make decisions. So what I recommend you do is plug the internal holes first. Figure out what's happening within the practice on a day-to-day right now. Then branch out to marketing strategies if you think you need to grow more than what you're able to do with just doing stuff internally. Maybe your case acceptance rate is 50%. Figure out what a good number is to you. Is good 70%? Is good 80%? Maybe great is 80%. Then work on getting that number up, and then you'll be doing more dentistry. Like, ta-da, you don't even need more new bodies. You just get the people who are coming to say yes more often. Today, I'm not going to talk about how to do all of those things. All of my videos in some form or fashion will cover all of that. Many have already been created if you want to go into the guides and look at them. But these are the key things. Identify your right now snapshot. Figure out what you want to accomplish and to figure out where to make change. Start internally before you start spending money externally. And then once you figure out where those places are, then you can figure out, where do I need help? What kind of training do I need? What next steps do I have to take? Do I have to ask someone a question? Who do I have to train? Who do I have to motivate? What do I have to learn? And you can take action. And then you get to the bottom of it, and then you fix all of it. It makes it so much easier. So I challenge you to do that. Just go get them, because you've got this. And I'll see you guys next week.